Hey guys, welcome back to another Something in About 5 Minutes. Today we're going to be talking all about cold exposure, specifically hypothermia. So let's get started. Alright guys, what brought this on was the fact that New York here is in one of their coldest spells of the year. It's been literally 2 degrees during the day, or like negative 18 with the wind chill here at night. So what we as EMS providers need to understand and need to remember is the fact that there's a lot of cold exposures that happen here in the northern part of the country, but there's also significant numbers of cold exposures that happen in the southern parts of the country as well. So we all have to be mindful of that. So what am I talking about when I am saying hypothermia? Okay? Normally, normal body temperature is 98.6 degrees Fahrenheit or 37 degrees Celsius. That is standard operating procedures. That's homeostasis. That's what we want. Okay? We consider it a low body temperature if it's 95 degrees Fahrenheit or below. Okay? And 35 degrees Celsius and below. Okay? Depending on which you guys use. So I want you guys to be aware that the ambient temperature typically does not have to be below freezing to cause hypothermia. So 32 degrees or 0 degrees Celsius does not have to be the case. Typically, statistically showing, it is anywhere between 30 degrees and 50 degrees Fahrenheit or -1 to about 10 degrees Celsius. And that is, statistically speaking, when the majority of cases of hypothermia start. Why we see this is not so much that someone's out in 2-degree weather, but they're out for a long period of time in 40-degree weather, or they're with wet clothing, or, as I said, lots of cases happen in the southern tips of the country where 80% of the elderly who fall in the state of Florida also are diagnosed with hypothermia solely because, why? They fall, they can't get up, they're on their tile floor, and their air conditioner's cranking, and now that cold air is falling down to the ground, boom, they become hypothermic even though it's 98 degrees outside. Okay? So we as EMS providers have to be thinking about these type of instances even if it is warm outside. Alright, so mild hypothermia, okay? This is core temps between 90 and 95 degrees Fahrenheit or 32 to 35 Celsius. Okay, you're going to start to see the body shiver to create that heat, okay? The pulse and the respiratory rate are going to be rapid. They're going to be tachycardic and tachypnic. Okay, your skin may be red, pale, or even cyanotic. Okay, you're going to get muscle stiffness. You're going to get lack of coordination. The patient should be still alert above 92 degrees Fahrenheit or 33 degrees centigrade. However, as that falls below 92 degrees Fahrenheit, you're going to start to see some confusion and some lethargy begin to start. When we move into severe hypothermia, now we're talking core body temps below 90 degrees Fahrenheit or 32 degrees Celsius, okay? Shivering ceases, okay? There's going to be a change from a tachycardic pulse to a weak and a slow pulse. These patients will start to tend to be bradycardic, okay? Their respiratory count is going to become slow. It might be prolonged, okay? There's going to be lots of time between breaths, okay? They may be appearing to be in a coma-like state. They're going to be unresponsive, okay? Typically, they will be unresponsive at this point in time. You will see some cardiac dysrhythmias. So, bradycardia, or you'll start going to see PVCs and all those different kinds of things. Maybe junctional beats or, type of blocks or something like that. You're going to start to see different type of cardiac arrhythmias with this severe hypothermia, and then ultimately this is going to lead to cardiac arrest. Now, one of the big factors that I need you guys to be aware of is even though your patient is in cardiac arrest, and they're cold does not mean that that body is not viable. And what I mean by that is, being that the organs have, been so cold, they've ceased to start working again. However, when you start to warm these patients up over a period of time, you can actually get pulses back. It's almost like a cryogenic type state, where now that you're actively warming these patients, over the course of a period of time, you might get a ROSC type situation. So don't believe that, oh my God, I found someone out in the snow, they've been out there for an hour and a half, and their cardiac arrest, they're pulseless. Maybe they're not totally, unviable at this point in time. The last thing I want you guys to just be aware of is the concept of active warming. When we're in that mild hypothermic state, we want to actively warm our patients. However, with our severe hypothermia, we don't actually want to actively warm them. Typically in EMS, we're not sitting there taking core body temperatures. We're taking axillary, we're taking, across the forehead or something like that, and we're not getting a good reading. Typically, the rewarm process for a severe hypothermic patient is 0.25 degrees Celsius per hour. We're not doing that, okay? We're throwing them on blankets, putting heat packs on, cranking up the hot air in the ambulance. We're trying to actively warm these patients, super, super quick. However, the data has shown that these active warming in these severely hypothermic patients have actually caused further brain injury because we're warming them too quickly. So please do not, unless your protocol says otherwise, do not actively warm the severe hypothermic patient. Okay, you still want to do it to the mild and the moderate hypothermic patient, but anybody under that core temperature of 90, we don't want to actively rewarm. So guys, I hope this was good information, a good refresher for being here in the winter. If you're in Florida, remember to check for hypothermic patients anytime you go to a fall down and go boom. All right guys, that's it for today's video. I will see you guys next Tuesday.